Welcome to today's episode of Oncology Data Advisor. I have the pleasure today of being joined by our guest, Tia Newcomer, who is the CEO of CaringBridge. CaringBridge is a donor-supported nonprofit health platform that supports family caregivers while they care for a loved one on a health journey. Tia, great to have you on today.
Thank you so much, Kira. I am thrilled to be here today.
Excited to have you. To start off, would you like to introduce yourself and share what you do in your role at CaringBridge?
Absolutely. I'm Tia Newcomer. I actually like to start with I am a caregiver, most importantly. I'm also a mom, a wife, as I said, the CEO of CaringBridge, and I have to always insert a Nebraska Husker that I love being outdoors with my white lab Luna. So that's a little bit about me. What I do at CaringBridge, we have this fantastic vision, which is a world where no one goes through a health journey alone. So I get to lead the team in achievement of that vision and our mission of surrounding people with support at every step of the health journey that they're on by activating their community and support.
Awesome. Thanks for the great intro. Look forward to learning more about CaringBridge today. Would you like to tell us a little bit about how it was founded and what its mission is?
Yes, so Sana Mering is our founder, and I love this story because it's the foundation of even what we do today. Her best friend had a premature baby who was in the NICU, and Joanne, who still volunteers at CaringBridge today, reached out to Sana and said, "I am overwhelmed. I obviously am focusing on the health of our baby girl, Bridget, and can you call all of our friends and tell them what's going on?" So by the second call that Sana reached out to this friend group, which was, by the way, over 100 people, she was like, "I can't do this. I'm emotionally drained. I'm crying on every call, and there's got to be a better way." So she went down to her basement and coded the very first CaringBridge page, and the rest is history. So I like to tell people and remind people that, and Sana specifically, that this was in 1997. So the internet was very like in its nascent stages. I think it was 2 years in. And Mark Zuckerberg was all of 13 years old. So what I like to tell Sana is you are truly the first inventor of social media for good. So that's our founding story, which I love to share.
Incredible story.
Oh. Yeah, I just love it. And Sana's still around. She's just an amazing part of CaringBridge. So we're all thankful. And when you asked about the mission, so our mission is to build bridges of care and communication, providing love and support on a health journey.
Great. It's such an incredible mission. So tell us, what services does CaringBridge provide in order to accomplish this?
Yeah, I'm going to anchor us in the four things that overwhelmed caregiver and or the patient that they are surrounding with support need. And it starts with the first thing that I just talked about that Sana was addressing, which is communicate. And so CaringBridge at its core helps people communicate out in that overwhelming time when everyone wants to know what's going on after either diagnoses or injury. So that's the first thing we do, and that's the foundation and legacy of what we surround people with support. The second thing that's a byproduct of being able to communicate out to your community is we help you capture what you're going through. And what we know from the research that we have is that very act of capturing what you're going through actually helps your emotional health and really helps you process what's going on. So that it's like journaling, if you will. It is journaling, for lack of a better term. And so that's the second thing we do. So communicate and capture. The third thing that is really important that we see jump to life on the pages of CaringBridge is coordinating help. And so coordinate. We help people coordinate help. And that could be anything from social and emotional support. So you see that in the pages of CaringBridge through the comments that people are making, but it's also tangible functional support that they need, whether it be things like meals, rides, financial support. And so that coordinating help is a really important part of what we've done since the day that Sana had that first CaringBridge page. And then the last thing from how we accomplish our mission is community. And it's at the core of what CaringBridge does, right? We activate your chosen community around you in support for all of those things I just talked about. Again, I like to come back to we activate your community in support of either emotional, social, or functional support that you need while you're going through a health journey.
Absolutely. And going along this theme of community, how does CaringBridge help to serve as a solve for social isolation and loneliness that caregivers may face?
Yes, so I'm going to go back to our vision, right? A world where no one goes through a health journey alone. And that word alone is pretty powerful, right? And so what we know both through research that has jumped off the pages of CaringBridge and also research that's generally out in the world is that feelings of being overwhelmed primarily and then followed that really leads to isolation and loneliness, and we know that that's prevalent among family caregivers and their loved ones that they're supporting on a health journey. So what CaringBridge has done for the last 27 plus years is we have addressed those needs by improving the emotional health and social support. And it's primarily through how we help people come together in supportive healing. And I'm going to share a couple of stats, and then I'd love to read off two quotes from users that I think will powerfully showcase how we solve for loneliness and isolation that begins with that feeling of overwhelm. So first, we know that 2/3 of CaringBridge caregivers receive a matched offer of help when they ask for it. So, and it's within 24 hours of their request. So the power of being able to anywhere you're at in those in-between moments when you're in the hospital or 2 a.m. when you just can't sleep because of what's going on, if you send that request for help out to the CaringBridge, your community at CaringBridge, they respond within 24 hours. So it's a phenomenal, powerful tool. Most of the support that's received is, emotional. Actually, about 40% is emotional, but the power of being able to ask for that physical, tangible, I'll call it functional help is, 30% or more receive that functional support when asked for. And that's something that we're working on to make that a bit more active part of what we do because we know it's so important. So I will to underscore that impact that we make for solving isolation and loneliness. There's two quotes I'll share, and they're short. The first one is, in this process, everything is so difficult. Insurance, your daily life. When you find something like CaringBridge that works and it's simple and it makes things easy, it's a godsend. So that keep it simple, easy, the things we do. And then the last quote I'll leave you with is from, again, a user is, it's the best place that you can share your journey, share your wins, share what you need for support. It's the best place for everyone to come and see your daily ups and downs and encourage you and to help lift your spirits. So that's what CaringBridge does when we think about overwhelm, isolation, and loneliness.
Those are some really powerful quotes that really speak to the value that CaringBridge can have in users' lives.
Yeah, thank you.
So I know that CaringBridge also launched a new platform recently. Would you like to tell us a little bit about this platform and the resources it includes that address social determinants of health?
Absolutely. So that new platform is a modernization of what we currently do. So built around what I talked about before, communicate, capture, coordinating help, and community. So it does that more simply. And we also have it in both mobile app and responsive. The thing that I'll bring to life that may be a little bit different, and when we talk about social determinants of health, is not it still helps you provide updates, right? So that's the core of what we do. It helps you share those significant milestones, and it helps you do that in a different way that's more visible than before. So the post types, as we call them in the new experience, really calls out what you need. Is it an update? Is it a milestone? The third one is requests for help. And that one is the most powerful because we're doing two things. We're enabling in this post type more visibility to what a caregiver or a patient needs. So how do they ask for help more easily? Because we know it's the hardest thing to do is to ask for help when you're going through a health journey. So that's a very different feature or functionality on the new CaringBridge platform. And then the last is something that we've done forever, which is a tribute, which is really how we survive. If people are listening, we are a nonprofit. So everything we do is funded by the users and generous donors that use CaringBridge. So that tribute is really a way for a person seeing value out of supporting their community or their loved one that's going through a health journey and donating to CaringBridge, but also giving a shout out or a support to the person that's going through the health journey. So those are the four, two are similar to what we've been doing, but they show up in a different way. So those posts really speak to action for the person that's going through the health journey. When we think about social determinants of health, specifically, I'm going to name some partners that I think will resonate with, as people are listening to this, of what does that mean of across financial, food, and transportation. So financial, an example I'll give you that we have a partnership, a very long partnership with GoFundMe. So that's clearly just a fundraising platform that people can activate through CaringBridge. But we're also incorporating partners like Healthwell Foundation, which is a $2 billion nonprofit foundation that gives funds needed to anyone that needs them to fill in the gaps for all of their healthcare costs. So that's an example of other partners that we're bringing on the platform to address financial needs. Food, we have Meal Train. We've had a partner with Meal Train for a very long time, but we're going to soon announce a partnership with Instacart. So again, the ability for that community that's surrounding you to deliver food when you need it and how you need it. And then transportation, I'll end with, and then I have one that's for all. But transportation, we are talking with Uber Care Health. They just launched a great new app around caregivers. So caregivers can not only fund, but have visibility to the loved one that is getting in that Uber and going to any kind of health appointment that they might have. So those are examples from a social determinants of health that are being either are on the platform right now and or are being integrated through the next couple months as we have the new platform online. And then the last thing I'll end with is that addresses all is in the next, I'll call it 30 days, you will see gift cards. And it sounds kind of like gift cards. But when we think about the ability for your community of choice to surround you with support, a lot of them want to help, but they don't know how to help. And so our ability to offer them, here's gift cards across all of these, from financial, right? It could be a Visa gift card, to food, it could be a grocery store gift card, it could be an Instacart gift card. So in transportation, Uber, Lyft, etc. So that's, we believe, is a really powerful way. It seems so simple. It's like, wow, why didn't we do this before? But it's a really great way to address all of those social determinants of health needs.
Absolutely. Those are all some amazing partnerships. And it's definitely really inspiring to hear about, the difference that they'll make in caregivers' lives. So one of my final questions for you is, since our audience consists of many healthcare professionals, what is something that clinicians should know about CaringBridge, and how can they get involved if they're interested in speaking to their patients about it?
I love this question. Thank you for asking it. Our goal ultimately is to be integrated into all health systems at the point of diagnosis or discharge. And so if you think about CaringBridge as the tip of that spear, really we would welcome and need the conversations of how do we get integrated. And that's different than right now. We have lots of champions. And so thank you to all of you that already are champions within health systems that are actively referring patients and their caregivers to CaringBridge, but we really want to be integrated into that point of diagnosis or discharge. So if you can reach out to me, or we also have partnerships at caringbridge.org to have that conversation. We would love to talk about how do we get CaringBridge really more integrated in a more meaningful way so that we address all the things we just talked about for every patient and caregiver that's going through the system.
Perfect. So as I wrap up, anything else you'd like to mention about CaringBridge, your ongoing or new initiatives, or any parting messages you'd like to share for our viewers?
Yes. One, CaringBridge, I mentioned it before, is 100% donor supported. So that keeps us no cost, ad-free, private, and our data is never sold. So that's really important when you think about other platforms. So if you find it in your heart, or if you have foundations, etc., please go to caringbridge.org. There's a donate button and/or contact me, and we would welcome a conversation about how you can support CaringBridge in a meaningful way. So that's my parting word. We are a nonprofit. I don't think a lot of people know that. And we surround every day 320,000 people come to our platform. So we've got to keep those donations coming in to support that and grow that.
Absolutely. Well, definitely encourage everybody to check out your website and reach out if you're interested in learning more. But thank you so much for coming on today to tell us all about CaringBridge. It's wonderful to hear about all the great work that you do. And I definitely encourage everybody to reach out if you're interested in learning more.
Kira, thank you.